Hey guys, so welcome back. So this is part 2 of my video series on nondescript back pain in elite runners versus novice runners. If you haven't checked out my first video, head to our website, on our Facebook page, like our page, and check out my first video because that goes through nondescript back pain in novice runners. So what we're going to do now is we're going to transition to elite runners. So whether you're an elite runner or a novice runner, back pain tends to manifest very much the same. So when we're looking at symptoms, same sort of things, that general ache across the lower back, getting sharp pain down through the middle of your back and into your pelvis, sort of like a general ache that can sort of move down the leg, what we also call like sciatic pain. So you can get pain, sharp pain down the leg, also pain with elongated standing or sitting, or even sharp pain when you're running. So these are the general symptoms that we find with back pain, and they sort of manifest the same between the two. So what I want to talk about now is, even though the symptoms are the same with elite runners, we find a few differences with basically why they're experiencing that kind of pain, and why back pain isn't just for novice runners, but it also, you get it in elite runners who are highly trained. So when we look at cause and risk factors for elite runners, we're thinking it's more due to your ongoing volume, your high intensity, stress and strain over time, duration, lots of training with very little recovery. A lot of elite athletes move from a domestic season to an international season with very little time off, and not giving their body enough recovery through massage, ice bath, dry needling, whatever other recovery methods that you find you need to use. We also find that with that ongoing volume, we have instability and poor force loading. So with what I find with the elite runners that I work with is single leg stability is often overlooked in preference of bigger movements such as power cleans, which when you find you're a runner, you spend a lot of time on one leg. So there's a lot of unilateral force. So it's really important that you address the stabilizers, and it's so important that you do enough work single leg, because as great as big compound movements, force loading such as cleans are, they are often used more in preference of single leg stability, and that's where the breakdown comes in that chain. It's that inability to stabilize unilaterally. The other thing that I want to talk about is this stress strain for a really long season. So again, it's really important that you've got macro, meso, micro cycles so that your athletes are able to basically taper off and deload. You want to do a deload every 4 weeks so that you're not getting that constant stress strain building over time. And that's where that back pain comes in, because it's that constant force loading that the force isn't distributed efficiently through the body. So when we look at exercise intervention, what I want to do is I want to break it up, because it's slightly different for sort of an 800 meter, 1500 meter, and sort of 3K kind of distance versus someone like a marathon runner. So when we look at exercise intervention for your 800, 1500, 3K, it's more about force application. So they have a much larger force application because they're running faster, and it's usually due to that dysfunction with those large agonist muscles, so your quadriceps, hamstrings, glutes. And that inefficiency and that poor force loading then creates that dysfunction through those big muscles, which is where we get that lower back pain shining through. The other thing is pelvic control. So a lot of athletes overlook specific pelvic rhythm exercises and lower abdominal engagement work in bigger movements. So again, when we talk about muscle activation, it's not just about engaging, but it's about being able to use it in those big movements. So pelvic control is so important to basically decrease that stress strain going through the lower back. So if you have really poor pelvic control, there'll be a massive increase in torque through the lower back, and that's when you start to get that degeneration, that ache through the lower back. Secondly, what I want to talk about is maybe if we're looking at event specific, so marathon runners. So the difference when we look at marathon runners, it's more about a lower force over a longer period of time. So the breakdown in marathon or longer running athletes is more to do with fatigue of the stabilizers. So if you're just running, the force is always generated efficiently, but then what happens is, because the stabilizers fatigue, you get that lateral movement, that rotation through the pelvis that causes that pain moving up into the lower back. So the auxiliary muscles that stabilize the hip and the knee fatigue, and that's when you get that movement, poor tracking through the patella, problems with the hip and the knee, which then obviously transfers that force back up into the lower back, and that's where that back pain can come in. So back to our exercise intervention from a progression plan point of view, when you're treating sort of a marathon runner or a longer sort of distance runner, 20K plus, where with exercise intervention, what we first look at is that muscle activation. So we go muscle activation, so getting those stabilizers firing, but then also looking at that unilateral force loading and strength force loading through single leg. So that's really important, like I was saying, because you spend so much time on one leg. So if you're doing too much bilateral work, you'll find that you're still going to get that increased force through the lower back and that back pain. Then we look at introducing musculoskeletal endurance. So remember, your typical marathon runner is spending a lot of time in their event, so a couple of hours. So what you've got to make sure is that they have the muscular endurance to handle that, so that single leg loading for a longer period of time so that the stabilizers can resist fatigue. And then we look at that running progression. So there's two different ways we usually program for longer distance. You're either working at above race pace for a smaller period of time, or you're working below race pace for a longer period of time. And it's so important that you integrate that strength and conditioning, that single leg loading into your running training, because at the end of the day, if you don't have the fatigue resistance through the muscles to handle the load that's being placed through them, that's when you're going to start to get that breakdown, and that's when you're going to start to get back pain. All right, guys, thanks for watching today. If you haven't had a look at our website, head over to the website and have a look at some of the other videos we've done. So we've got a whole variety on different things related to running, jumping, strength and conditioning. If you need anything, give us a call. Our number is 3356 9119.